Welcome back here to Good Morning Arkansas. We have Dr. Doug Borg here to share details. We're going to talk about this year's Festival of Wines and also some very important information about peripheral arterial disease. Did I say that correctly?
Yes, correct.
It's a mouthful.
Yes.
But you're a cardiologist over at St. Vincent's.
Yes.
What is peripheral?
Well, it's a disease process that affects the arteries of the legs. It's very similar to the same process that affects hearts, essentially people that develop heart disease or stroke, essentially. It's plaque buildup in the arteries.
And you can get that into the legs as well.
Yeah, the same process that affects the carotid arteries toward the brain or the coronary arteries of the heart can affect the legs. And it's sometimes rarely the upper extremities, but predominantly the legs.
And what are the symptoms?
Well, the symptoms are similar to what you'd expect with angina of the heart, which is typically pain down the legs, usually in the calves, sometimes in the upper legs or the buttocks, but typically it's worse with exertion and better with rest.
Is there any reason why people would develop this?
Well, the typical risk factors are the same as people that develop stroke or heart disease. So the common risk factors are diabetes, smoking, high cholesterol, high blood pressure. If you've had stroke or heart attack in the past, that puts you at a higher risk as well.
So if you have any of the symptoms, you go in, how do you test for it?
Well, testing is actually pretty easy, at least screening. All we do, blood pressures in the arms and the legs should be approximately equal under normal circumstances. So if all we do is we check blood pressures in the arms, we check blood pressures at several locations in the legs, and if there's a reduction, that suggests maybe a blockage. The next test we would do is what we call a CAT scan of the arteries essentially from the abdomen toward the feet, and we look for actual blockages at that point. And then usually we would go from there. So.
Okay. And so how would you treat it?
Well, medicines are always the first choice. So we always start with aspirin. We always start with cholesterol medications to try to slow the process down. Exercise training is actually something that's very good. For people that do not do well, remain symptomatic, then we move on to potentially procedures. And much like a heart cath, we would do a peripheral angiogram looking to diagnose exactly the extent and the location. And if it's in a location that's good enough, then we can try to open that with a balloon and a stent.
So you're basically doing some sort of heart surgery on the leg with the stent.
Very similar stuff. And for people that have really severe disease, sometimes we have to move to bypass surgery, just like we do with the heart.
Okay. Is there a risk? I've heard about people with blood clots in their legs, of that being thrown into the heart and going to the system?
Well, you know, the veins lead back to the heart and the lungs, and so the arteries are going the other direction. So, But what we see sometimes, especially in advanced disease, is that people's legs become cool, pain at rest, and that's actually more of an emergency. That reflects severe disease. Some people have chronic wounds that just don't heal and they can't figure out why, and it may be because the blood supply is so poor that you just can't get good wound healing.
Okay, and if you have any of those symptoms, what are the symptoms again?
Well, you know, typically a cramping or a burning in the lower legs. Some people confuse this with sciatica, but sciatica typically occurs in certain positions or with sometimes walking, but it occurs a little differently. But that's what your doctor's there to help you distinguish.
Okay, so you should seek immediate medical attention.
Yeah, so your primary care doctor can help screen you, and certainly if you need referral to a cardiologist or a vascular surgeon, then they'll handle that.
Okay, and you guys have got an event coming up that you're sponsoring.
We do. St. Vincent sponsors, is one of the sponsors of the Festival of the Wines. It's an event that benefits the American Heart Association and raises a lot of money for that organization. So we're real proud to be associated with it.
All right, and so this is coming up. My days are so messed up. This is probably next, Thursday?
I believe so.
All right,
October
next Thursday night at Dickey Stevens Park, just across the river in North Little Rock. If you want more information here, the phone number is area code 501-707-6600, festivalofwines.org. And you know, that's a kind of a good thing to have a glass of wine, is what your cardiologist say.
Absolutely. Red wine is good for the arteries.
Okay, red wine, not any of the other type of wines.
Well, red wine.
Not wine in a box.
Box counts.
Box counts. Okay, but you say a glass of red wine helps.
Is thought to be beneficial. It's debatable, but in general, the thinking is that part of the Mediterranean diet is red wine, and that might be beneficial in some way.
Okay, and I'm being told that is a Thursday, just in case you have any questions. But you said people with diabetes. If you have diabetes and you suffer from that, Are there any precautionary measures you can take to prevent yourself from
Well,
getting
typically
this?
control of diabetes and stopping smoking. I mean, obviously you want to stop your bad habits. Certainly, you know, people with diabetes have trouble with their diets most of the time. And so certainly I think that's probably the primary preventive thing you could do.
All right. Thank you so much, Dr. Borg.
Looking forward to the
St.
event.
Vincent.
It's a great event. You should come visit.
Everything in moderation.
Absolutely.
Just a glass of wine every now and then. All right. Thank you very much for coming on the show.
Appreciate it.
It's
Thank you
Dr.
very
Borg,
much.
and you can be contacted over there at St. Vincent,
Absolutely.
right? Cardiologist over there. All right. Coming up on the other side of this.